will allow you to change your name temporarily, or you can always shut your screen. But we do want to let everybody know this is a very public meeting. With that said, I want to turn the meeting over to State Representative Eric Allen, who, as I have said many times, the highest compliment that the council can give an elected official is that they are family. He is family. We love him deeply. We respect him very much. He has also done something incredibly impactful for the recovery community. Along with his co-chair, State Senator Randy Robertson, he has organized and assembled an official working group in the General Assembly called the Working Group on Addiction and Recovery. Now, sometimes people say that I get a little excited, but to understand that only maybe 2 other states, maybe 3 other states have a similar entity in their General Assembly, and to have our cause, our disease, our community be recognized in a formal manner by our General Assembly, that's a big step in the right direction to break the stigma and to create healing and to save lives. And at the very top of that list is the co-chair of the working group on addiction and recovery, and that is Representative Eric Allen. Sir, the floor is yours.
Well, thank you very much, Jeff. I won't take up too much time because I know what we really want to do today is hear from you and Neil and from the community, but I just want to say thank you for setting this up and providing us with an overview of the things that are important to you all. I think that's extremely important to hear, and I wish we were able to have a few more meetings this year, but the session was suspended after only our first official working group meeting. So this is a really good forum and maybe something we can do going forward so that it gives people more access into the meetings, so they don't have to come down to the Capitol. But I do want to acknowledge my colleagues that are on and thank them for their participation. You got a list up here, so it helps me because I don't have to look down at my paper. But from the Senate, we have Senator Renee Utterman and Senator Kay Kirkpatrick, who I have the pleasure of serving with on the Cobb County delegation with as well. And I know that she's working on some very important legislation that we are anxious to get back and support. We also have from the House, Jody Lott, Katie Dempsey, Sharon Cooper, Matt Gamble, Angela Cowshay, and Bonnie Rich. So having 10 members that have confirmed, there may be others that jump on or off at different points, but I do want to acknowledge them and thank you guys for your continued support and participation of the recovery efforts that we have going on in Georgia. So Jeff, I'll turn it back over to you. Or is it Neil? I know it's one or the other. But, okay, I'll turn it over to Neil. But after the presentations from Neil and Jeff, if any members of the General Assembly have questions, I ask that we defer to the body first and allow us to ask any clarifying questions we may have before we turn it over to general questions, if that's okay.
Absolutely. Yes, sir.
Okay, so with that, Neil, I'll turn everything over to you.
Thank you, Representative Allen. Thank you, Eric. Thank you all members for being on. Jeff said it best that, having elected officials, constitutionally elected officials on our call and paying attention to recovery is a dream come true for all of us. There was a time when that didn't happen. My name is Neil Campbell. I'm the Executive Director of the Georgia Council on Substance Abuse. I'm also a woman in long-term recovery. What that means for me is that next month in July, it'll be 30 years since I've had my last drink or illegal drug. And I speak out about my recovery because I want everyone to have the opportunities that I've had to get and to stay well. And because of my recovery, I get to surround myself with people that are on this call today. And if it weren't for my recovery, I would not be here today. And one of the things that I always lift up is that one thing Georgia does really, really well is peer support. Is peer-run organizations, is peer helpers out in the community. And that's because the legislators have looked at us and seen us as a constituency of consequence to say these folks are in recovery, they've overcome, they've been in jail, they've been in prisons, they've been in institutions, and look, now they're working, they're in the workforce. So we have a tremendous peer workforce in this state. The only reason that I have any hope right now, after seeing the budget that was released on the Senate website today, The only reason I have hope is because you are all here. Senator Unterman, Senator Kirkpatrick, Senator Allen, Senator Lott, Senator Dempsey, Representative Lott, Representative Dempsey, Representative Cooper, Gamble, Kaushi, and Rich. Thank you. We could not, I would be hopeless if I wasn't surrounded by you today. So thank you for that. And the reason is because, so on behalf of the Georgia Council on Substance Abuse, statewide RCO, and several, I'm looking at the participants here, you have several local recovery community organizations on the Zoom right now. We just want to say thank you for listening to us and for paying attention. It really is our honor. I wanted to start how we usually start, is by welcoming everybody. This is a really, really trying time. 3 months into this thing, just about, or coming up on it, it feels like, on the COVID-19 crisis. We're having some physical challenges, but also psychological and emotional challenges. I don't know about you, but having a 3-day weekend in the middle of a 200-day pandemic just wasn't all that it used to be. But I want you to know, we want everyone to know you're not alone. Recovery community has options. We have stood up for each other in the virtual online 12-step meetings, as well as our all recovery meetings. And I want to say thank you for that. What we are saying to each other as a staff and as to our peers is, first off, listen to the health experts. Remain hopeful. Practice wellness. Lead with love. Keep your heart soft. Keep your heart open. Stay connected. The opposite of addiction is human connection. And please, please check on each other. One of the things that we know about COVID-19, what it's brought, is an attention to what our economy is going to look like going forward. And so the governor gave an order to all state agencies to submit, my understanding is, a 14% budget cut. Started the year with a 6% cut. That kind of got wrapped up, and then and we're working that out, and then COVID hit, and now it's a 14% cut. And we will post the document at the end of this town hall. There's a document, a budget document that's out right now, and it is devastating to our recovery community. I can't say this enough. It feels like a 3-alarm fire. Again, peer-led recovery support is a huge strength in our state, and it is being decimated. The cuts from the Department of Behavioral Health and Developmental Disabilities will pretty much wipe out the progress we have made in the last 8 years of having our recovery listening sessions in communities from up to in Walker County down to Brunswick, and all points in between. And I'm going to show you that in just a second. I just wanted to show some pictures of hope. We were at the Capitol not that long ago, back in January. Seems like 10 years ago, we were all together and hanging out at the Capitol and lifting up our voices for recovery. And we had over 1,200 people there. What the addiction recovery support centers are slated to be cut in the recommendation from the Department of Behavioral Health. Just wanted to give you some data, show that the state legislators, if I was testifying in front of you today, I'd be glad, because you're all friendly faces, but first of all, and second of all, I'd be proud to show you these data. These are data from the 16 state-funded addiction recovery support centers, and it's phenomenal. We stood these programs up quickly. The communities were ready. They opened their doors within months, and you can see the top is the amount of recovery support services that are happening on a monthly basis in these programs. I challenge anybody to tell me that 14,000 peers are being served in any other realm in this state, any other service or supports. The unduplicated individuals is just phenomenal as well. You had 3,000 people being seen at the peak, close to 4,000 people a month. Individuals are being seen in this state. I challenge you, look at the data, see what it says in the other, whether it's outpatient treatment, whether it's residential treatment. You get so much bang for your buck in these centers. And they're all community-based, and they're all different. So when we look at these and we say, man, recovery, we're trying to reduce the stigma. We're trying to make it okay for people to walk into someplace not necessarily having a diagnosis, may not have insurance that covers recovery support. Most of it doesn't yet. But these are services and supports that are actually serving real people, thousands of real people every month, all across the state. And we can provide you with a map as well. We have that data too. So just by looking at the first page of cuts that I see on the end, again, we'll put this in the chat box at the end. We will see the reduction of funds for all of the recovery centers, $4 million gone. Reduction of funds for treatment courts for 8 providers, gone, $850,000. Treatment courts, things that keep people out of expensive institutions. They eliminate the funding that we have at the council for the technical assistance and training, eliminates peer support in Kennesaw State. And by the way, I have 35 people that work at the Georgia Council on Substance Abuse. All of us are in recovery. Most of us have a criminal history. We are all well trained and doing specialized things in communities that would not be happening if it weren't for the council. Also eliminate the peer support at Kennesaw State. Eliminate funds for a neonatal intensive care unit peer recovery coaches when Georgia ranks in the top 10 worst in infant mortality. Eliminating that, $250,000. And then prevention, treatment, recovery supports services for pregnant and postpartum women. Again, Georgia's at the bottom and we're cutting those services. This is just a taste. There's others, and I just wanted, because you are the recovery work group, we wanted to highlight these, but we know it's going to be brutal. And you know, let's take 14% of that 4 million. I'm willing to do that. Why are we cutting all of these services? It just doesn't make any sense. So I'm going to let my plea go at this point and just put this out there. And we will be organizing around a lot of this stuff in the near future, because in the middle of this pandemic, we have this thing called an epidemic. We're still losing 4 Georgians a day to overdose, opiate overdose. If you ask emergency room docs, the #1 thing that is clogging up their emergency rooms, bringing people to the emergency room right now, it's domestic violence and substance use. We're cutting these programs and supports in a time when we need them the most. Isolation is sinking in. People are not getting the supports and services that they need. They're afraid. So this is just not the time. We understand that there are budget priorities, there are budget realities. We realize that. We just say, please, let's look at what actually is happening and how we can all work on this together so we're having the minimal impact on our budgets. And I am going to turn it back over, I think, to Jeff. And I don't know if there's, or also, let me say this after that, because I think I'm going to need to call the CARES form line. 8:30 in the morning until 11 p.m. Talk to a recovery coach. You're not alone, but please remember you can do that anytime. And I'm going to turn it back over to Jeff.
Thank you, Neil, and thank you again to Co-Chairman Allen and to all the members that are on here and all the peers and allies that are on here. I was reviewing the chat box. I mean, there are people from as far away as Valdosta and Brunswick and Jessup and across Metro Atlanta and over in Athens and up in Rome. And I mean, this is truly a statewide community. This is a statewide constituency, to put it in terms that we might talk about at the Capitol. You know, it would be a miscalculation for members of the General Assembly to say, well, this is just a problem in downtown Atlanta. This is urban, it is suburban, and it is rural. This medical issue cuts across every single demographic that a person can come up with, period. I would submit to the General Assembly that this is one of the few issues that is truly nonpartisan, that impacts people, families, communities without discrimination. And I want to challenge and push back on another premise that we heard, I guess it was last week at our rally for recovery, with frankly, a couple of members saying, well, we're all equal in this round of cuts. With respect, I have witnessed many budgets at the Capitol, and there's always some exceptions made for certain entities. Well, I would submit to you that medical issues need to be exceptions during the middle of a pandemic like COVID-19. Now, I understand that there's going to be cuts. But what I said to my dear friend, who I used to work for, Mike Dugan, the majority leader of the Senate at that meeting, I said to him, and I say to each of you, that we understand there are going to be cuts. But our cuts cannot be 75% while others are 14. That kills people. And we are not going to be quiet about that. That is unacceptable in any form or fashion. And I will say that to my friend, Governor Brian Kemp, and I will say that to my friend, Commissioner Fitzgerald, and I will say that to anybody that needs to hear that. If there are to be cuts, ours must be in line with the rest of the states. However, there should not be cuts. The case should be made that mental health, substance use disorder, domestic violence programs, and human trafficking programs are going to see a disproportionate increase in the next number of weeks and months. That's not a theory, that's a fact. And those are going to result in one of two things, maybe three things. No support from the government, the state pushing it down to counties and cities, and members represent counties and cities. Those budgets, they don't have the money to provide for those 4 epidemics coming. Or less safe, less healthy communities with cost increasing in other parts, in emergency rooms. Ask any sheriff, ask any police chief, any one of them. If it's cheaper for the taxpayers to have RCO programs around the state and warm lines, are cheaper for the taxpayers to have to put a person with a medical issue who they do not want to arrest in the criminal justice system. It's not even smart business sense for the state of Georgia. It is not a smart taxpayer position to eliminate these programs just when we need them the most. So the General Assembly and Governor Kemp appropriately supported our frontline medical institutions at the beginning of COVID, those frontline workers. This is the next part of COVID. In mental health and substance use disorder, and just to be transparent, domestic violence and human trafficking, those are going to be the big 4. Now, this may not be a made-for-TV crisis where you can turn on CNN or Fox, whichever you prefer, and see a truck outside a hospital in New York City with 50 dead bodies in it. That makes for good TV. But the deaths in Georgia, if we cut these essential medical programs in the middle of a pandemic, are going to be just as real. The cost to the taxpayers are going to be just as devastating, and the destruction in communities around the state are going to be catastrophic. So, you know, I'm just here to educate. That's what we are supposed to do as an advocacy group. We are so thankful to have allies such as yourselves on this call. We're so thankful to have all the members of the General Assembly. And what you deserve, what our job is as a community, is to show up and speak up. We show up professionally. We speak out respectfully. But we have all witnessed, those of us at the Capitol, and there's some people on this call that have been a part of it, peers, that when you show up and are present and visible, that makes a difference. So our promise to you, our commitment to you, is that we will do our part as a community. We will make sure you know we have your backs. We will make sure that you can tell your colleagues with integrity, with confidence, that Georgia cares about substance use disorder and mental health issues, and that they are educated on those issues, and that they are talking about those issues, and that it is not a risky position for us to take to support those issues. For every naysayer that's going to tell you that those people don't deserve our tax dollars in a crisis, you deserve to know that our family, our friends, those that employ us, we've got your back. We are here for you, and we are paying attention. You have our undivided attention, and we know how to say thank you. and we will be doing so.
Yeah.
And so we are ready. We are organized.
Everything lately.
And
Yeah,
we are,
Do you know him?
I
somebody's
met him.
and we are, we're going to show up. Neil has taught us over and over and over, nothing about us without us. And I've thought about that phrase many times the past few days and weeks. And I like words, and I get wordsmithing, and that's a very effective slogan. But I'm determined that that is no longer just a slogan, as good as it is. It's our job to make that a reality. The peers need to hear this. We cannot ask Eric Allen and the members of a working group to support an issue with the stigma around it. And we know there's a stigma around our issue, unless we're there for them. And so we're going to be there for them. We're going to have more virtual rallies. We're going to announce or show you about the car rally later in this meeting. We're going to go to the Capitol in a safe and social distancing manner when those dates are announced. We're going to get on the phones. We're going to send the emails. We're going to get on the social media. And we're going to do those things we need to do to make our case that we are a medical issue, that not all issues are not equal in this budget, that this time others may have to make the greater sacrifice. And so I'm going to begin to wrap this up by just reminding everybody that can hear my voice. These are Death Star like blows. This is not a scalpel in a surgical maneuver so far. But we also understand the following. This is just a proposal. It's just the beginning. What a blessing for our community to have members of the General Assembly that would give us their time, in, no pun intended, in general, to form a working group and then get on a platform such as this today and listen to us and let us share with them our passion, our facts, and that's incredible. So the game, well, it's not a game, but the mission has just begun. And I want to remind everybody that an initial proposal is not a final document that members will vote on. And back in January, there were some more cuts proposed to our community in that supplemental budget in the beginning than ultimately went through. And it's only because, it's not because of Neil and Jeff and any of us, it's because of Eric Allen and Katie Dempsey and Renee Underman and Kay Kirkpatrick and all the other members. I can't see the screen right now, but all the other members of the working group, they're the ones who went in the committees. They're the ones that went in their caucuses. They're the ones that cast the votes. They're the ones that did the heavy lifting for us. They're the ones that met with Governor Kemp and said, hey, we've got to restore some of this funding. It happened in January, so I know it can happen again. And we're going to do our job to give them the support they need to be able to convince and make the professional case in the appropriate manner, in the language of the General Assembly, that the Georgia recovery community, the mental health community, these are communities that are medical issues that need support now more than ever. And they are citizens who are engaged, they pay taxes, they support families, they're the best of our communities, and we don't want to undo the good work we've done. And so, Representative Allen, Neil, I will yield there and turn it over to you, sir.
Well, thank you, Jeff. And thank you, Neil, for laying out, not only your concerns, but also the case of value. I think to your point, both of you guys point to make drastic cuts now in the short term will only impact our ability to solve the expensive problems that will come in the long term. So we have to be smart about how we do these cuts and make sure that we're advocating for the right things. With that said, if there are any members that have questions, comments that you'd like to share, just unmute yourself. We'll start with Senate. If Senator Kirkpatrick or Utterman have any words, Kay, I see you've already unmuted, so I'll turn over to you.
Yeah. I just want to be sure everybody understands the process, and that is that the budget recommendation from the governor was already sent over a while back, and the House dealt with it, sent it over to the Senate. So it's now sitting in the Senate Appropriations Committee, and those members are posted on the website. Presumably it'll go to the Health Subcommittee, although I'm not 100% sure about that. And then if there's a disagreement with what the House sent over, then there'll be a conference committee that will come up with something, so that by the time it gets to the individual members, it'll be a green or red vote for the entire budget, not just piecemeal. So people need to understand how that works. The other thing I would tell you is that, you know, there's really no good news in the state budget. People are going to lose their jobs. There's no question about it. And so we have to put it in the bigger perspective of this crisis is, nobody asked for this. Nobody was looking for this. And so we need to be just careful about casting blame around for the situation that we're in, because it's really nothing any of us could have done to anticipate this even 2 months ago. We need to be thinking about other options, and Jeff mentioned that a little bit. I wanted to highlight something that's happening at the federal level, and that is our very own Newt Gingrich, who's in Cobb County, has started an organization called Advocates for Opioid Recovery. And they have a website, and they are heavily engaged at the federal level in trying to assure that there's access to evidence-based treatment included in the next phase of the COVID recovery package that happens at the federal level. So don't forget about the feds. They are continuing to put packages together for COVID recovery, and we need to be able to intervene at that level too. The local level, Jeff already mentioned, but if we think these programs, which nobody would argue how valuable these programs are, if we think they've just got to continue, then regardless of what happens to the state budget, we got to find ways in the community, whether it be through nonprofits or our own efforts, to keep the programs going. So we can't just rely on state funding, because everybody's going to have pain there. So I'd encourage you to look at the website that I mentioned. It's Advocates for Opioid Recovery, and there's some good information on there that might be useful. And I'm not on the Appropriations Committee, but the members are listed on the Senate website. So feel free to reach out to those members as well as your own senator and representatives. That's all I have.
Thank you.
Thank you, Senator. Is there anyone else? I can't, it's so many people on the call, I can't see everybody's face or list of names, but if you are a member and you have comments, just unmute yourself.
133 plus 30 something.
So it doesn't sound like we have it. Did you have any more questions? Any questions that came in, Jeff?
Well, I think that I think Sharon Cooper does want to say something. She's calling in and
okay.
establish what number she's calling in from. So Sharon, if you can, Representative Cooper, if you can hear me, you've been texting with me, but I need to figure out which number you're on, ma'am.
Okay, have you got it now?
Yeah, we got you. Yes, ma'am. Great job.
Okay, you still need my number?
No, ma'am. No, ma'am. You're good to go.
Okay, thank you for an opportunity to listen to the problem. Sometimes I think departments send a statement over to the legislature by picking an area of their budget that they know will cause a great outcry to cut drastically when they don't want things cut. I certainly hope that that is what they have done in this instance, knowing Jeff and Neil, that the community would rise up and that there would be those of us who would work hard against these kind of cuts. I mean, peer support has proven to be one of the greatest assets we have in dealing with substance abuses, and to see it so drastically cut, especially because we are going to have the death due to the virus, but we are beginning to see increase in death from people that were in recovery, going back to opioids, going back to alcohol, an increase in the suicides. And in essence, those deaths need to be really counted as part of the deaths due to the virus because of this crackdown. And I just appreciate the fact that you've done this call. I think we all need to work hard. I am very glad I am not the appropriations head or in the House, any of our chairmen, because it is a very difficult task. But I agree with you, Jeff, that one area should not bear the blunt of the biggest portions of cuts, and that, you know, that it be spread across. And so I just will tell you that I will do everything I can. I mean, I know that the governor's office is concerned about mental health. I certainly will be talking to them after this meeting and expressing my concerns. So just know that there's definitely been, I feel like, a positive outcome on this meeting of making those of us in the General Assembly that understand mental illness, that understand substance abuse, that have championed these, you know, bringing this out into the open, letting people feel accepted, that they have a medical issue, that this call has helped inform us of what's going on, because not all of us are on the budget committees, and that it gives us an emphasis, the, you know, for all to go forth and put our opinions out there. So as health, I certainly feel like I have been one of your big advocates over the years. I have been an advocate for better mental health coverage and care for people for years and years, and I'll certainly be working to try to help you as best I can. Thank you for doing this. Thanks, Eric, for doing it.
No, thank you for being here, Sharon. I saw that Senator Utterman took herself off mute. I don't know if she wanted to speak.
Yes, I
Here,
think she
I'm
texted
here.
you.
Yes, I
Yes,
did.
yes,
Yes,
okay.
I did.
Okay, there she is.
I just appreciate.
There she is.
Yep. I appreciate y'all. I appreciate y'all putting this together. Excuse me. I was actually at the doctor's office last week. I had asthma, and you can tell I still got a little bit of it. But while I was at the doctor's office, I was turning on the video and watching y'all. And unfortunately, a couple of times I didn't have my phone on mute. And the people in the doctor's office waiting room were looking at me and thinking, what is that woman doing? But I did get a few snippets, and I want to especially say thank you to Senator Kirkpatrick, because, you know, I'm leaving the General Assembly in December. And I think it's very important that we mentor and we bring along the people that are interested in our particular subject matter. Because it's one thing to work on a subject matter for 20 years, but then you up and leave and all of a sudden it evaporates. And I'm so proud of Senator Kirkpatrick for stepping up to the plate and taking over the mantle that I've covered for so many years. And what's particularly important, she's such an easy student because she already knows the background, being a physician, and she can run with the ball. The only thing she needs to do is knowing more about the appropriation process. And, you know, it took me 5 years to understand the state budget. And you say, well, why were you so dumb, Renee, that you couldn't learn the state budget? Well, first of all, the state budget is $27 billion. And every time you look at a line item, it's connected to another line item, and it's connected to a special interest group. And you really have to study it. And you know, the dean and the master of the state budget is gone. And unfortunately, he passed away, Jack Hill. He was my mentor. And, you know, that's important. And the reason it's important because someone of the stature of Jack Hill care deeply, deeply about behavioral health. And there's going to be a huge void next year, especially in the state Senate, because a lot of institutional knowledge is being vacuumed out. And that's why it's so important to have advocates who will educate the new members that are coming in. These are people that have absolutely no experience, some of them in state government. And it's up to you. And you say, well, our job is never done. And you're exactly right. Your job is never done because you're educating these new people and you're bringing them along. And, you know, you're the best advocates. You know what's happened to you. You know what's happened to your families. You know the devastation to your community. But it's your job and your obligation, it's your fiduciary obligation to pass that knowledge along. It doesn't do any good to sit at home on the sofa and say, nobody's helping us, nobody's helping us, nobody's doing anything. It's your job to get motivated and to spread the word. And I realize that it's difficult to spread the word when you're in the circumstances we're in. But, you know, you have to deal with the hand that's been dealt to you. You don't have a choice, and you have to make the optimum out of the situation. And if you don't, you're going to get left behind. And my favorite saying in the General Assembly is, if you're not at the table, you're going to get eaten underneath the table. So if you want your fair share, you have to fight for your fair share. And the best thing you can do is to find those advocates that are good fighters. Because if you don't have good fighters, you know, you're out of luck. But along with every good fighter, you can have 10 people behind you. And that's what I've had. I'm a good fighter. But I had those 10 people behind me that I could pick up the phone and say, look, I'm worn out, I'm tired. And they would give me moral support saying, Renee, you can't back down. Renee, you got to keep fighting. Renee, you're the spokesperson. We're behind you. You get out there and you do your job. We're going to do our job with the other 9 people. So with that said, I think that was a little pep talk. If you didn't get the pep talk, you call me personally and I'll give you a pep talk. I want to say a couple of things. I read this morning in the paper, one of the papers, I read a lot of papers every morning, where the incidents because of COVID-19 and the post-traumatic from it, that the incidents of psychiatrists writing psychotropic drugs for depression and for the symptoms resulting from isolation have gone up dramatically in the month of April. And I understand giving these medications, but I also understand that a certain percentage of the people are not going to come off of those medications, or they're going to have difficulty coming off those medications. And that's where our advocacy and the CARES warm line and these dollars that we put into the budget are so crucial. The other thing is, I've asked the Department of Behavioral Health and Developmental Disabilities to come up with the statistics on suicide and to look at the incidents in the month of January through our current data, and to look and see where those spikes are, and also on overdose, to see how many overdose fatalities, and look at that correlation to when the orders came down about isolation. And that data is coming to me for January through April, and I have not gotten it yet. I know I don't have much time, but I do want to talk about a couple of things. The RCOs and the recovery centers, they were my dream, and they are my baby. And if you can ever believe, I have about 9 months, not even 9 months left. I'll probably have about 6 months left in my term. But every ounce of energy that I have, and Sharon Cooper is exactly right. The department knows what to cut because they know the strongest advocacy groups. And they know that if they cut out that $4 million, that we're going to squeal. But the question is, are you going to be able to squeal? And are you going to be able to activate your advocacy group? And, you know, it's a slippery slope, and it's a dangerous slope, because if you don't advocate them, you're going to lose the $4 million. And those 15 centers across the state of what they've accomplished and their vision is one of the success stories. And I agree with you wholeheartedly. You cannot go across the budget and say 14% of a $17 billion budget is going to be cut. And there are particular favorite programs, just like I have pet projects. Every senator has a pet project, and every senator is fighting and saying, I want to save this program because it's doing this. And every one of them has valuable assets. But I think what is key to us is that we're taking care of people, and this is life and death. And this is life and death day to day and week to week. And while you're in the middle of a pandemic, oh my gosh, you do not cut programs that are filling in the gap of such a tragedy. And I want to say thank you to all the RCOs that have improved their platform and allowed access to care with virtual programs. But the sad thing is, a lot of people, and you already know this, are low income and they do not have access to the internet. And that's the hardest part, is knowing that you're leaving behind a certain segment of the population that has no access to be able to have the peer-to-peer support. I want to say especially thank you to Gwinnett County and Navigate Recovery. Susan Barsh has done a fabulous job. I want to say thank you to the Connection in Forsyth County. They're doing a fabulous job. But these are very wealthy counties that have that ability to step up to the plate. There's lots of counties, and I know because I've visited those counties, I've stayed in those counties in South Georgia and the counties up in the mountains, and especially those counties in the mountains that do not have internet access and oftentimes do not even have cell phone access. These are people that are desperate for help, and we have got to reach out to them again. The other thing I want to mention, and I'm going to close out, the treatment court services, they are the gateway. They are the keepers of who gets treatment and who does not get treatment, and who gets into recovery and who doesn't get into recovery. We have to have that restored money. We've come too far. We're an example across the nation for recovery. And those treatment services are a part of criminal justice reform. That money has to be restored. The other thing is, we have been written up in national journals across the nation about this NICU program. That's the neonatal intensive care unit, where nurses came up with solutions of how to take care of babies who are addicted to cocaine or opioids or street drugs, or they had fetal alcohol syndrome. That program has been replicated because it was written up in those journals, and places like the National Conference of State Legislators have focused on those programs. What a success story. And you're telling me out of a $27 billion budget that $250,000 can be cut out. I don't think so. If you've ever seen a baby, a newborn baby that is 1 or 2 or 3 days old, going through seizures and withdrawal symptoms, there is no amount of money that you wouldn't be willing to put down. The other amount is the $50,000. These nurses came up with this program, and you can better believe that I'll be there fighting for that program. I think that's it. I could talk all day long on the subject matter. And God bless Neil. God bless Jeff. And we have the energy, and we are going to activate. And we're going to say our story, and I'll be there saying the story with you. And what an honor. Thank you so much.
Thank you, Senator. Thank you so much. And that, you know, I was there when you were formulating the NICU program, and at that time they had 11 babies who were born with drugs in their system at the time, and the nurses were just didn't know what to do, and they don't have that problem now. We've helped reduce the number of bed days that those babies spend in the NICU, and that's at least $3,500 a day. So it's the return on investment for these programs, the peer programs, we're starting to calculate it now. And so thank you for your leadership in this area as well.
Neil, Representative Allen, I think we have Representative Katie Dempsey. Representative Dempsey, you should be able to unmute yourself at this point.
I think I did it. You got
There you
me?
go. Yes, ma'am. Yes, ma'am.
Great. Great. Well, thank y'all for pulling this together. Representative Allen, thank you for your heart and your passion to organize and coordinate the working group. It's so important. I've been on so many of the calls that y'all have had during this very unprecedented, unique time. I know we say that a lot, but it's true, and it's important to embrace that and to realize that there are so many challenges that we've never walked through before. You've heard from some great advocates, no doubt, from Senator Kirkpatrick and Chairman Unterman and Chairman Cooper. I echo the messages that they have presented this morning. I don't this afternoon, I guess now. I don't want to repeat what they have said, but I think it is so important to really realize that when people have not been employed and have been in isolation, and the statistics, but plus just the awareness that we all know exists of the incidence of addiction or of just overuse or abuse, or the doors that open to create bigger and bigger problems. We're not in a time of reduction. We're in a time where those needs are increasing every single day. And then as we begin to come out of this, and as we get to the other side of this budget that I think we're all hoping can be impacted in a different way than it sits today, we're going to have to take care of who shows up at the door. There's not a lot of control in that. And we hope they'll find the door, and we hope we'll be there to help them. Your voices, your coordinated efforts that are so important to deal with what is presented as a proposed reduction right now. So many of them, and so many of those that intersect and greatly impact real lives every single day. You've worked so hard to get us to a different place. I can remember the first time I heard Neil, and it was back when there was perhaps one of the first working groups with Jay Neal pulling us together at that time, and how important her message was, but how surprising it was to so many people. I do not think that today you are surprised. I think that your work is appreciated and valued and known, and it is falling into the reality that we're walking through right now. But I do think that we benefit in so many ways by raising you up and by changing the proposals right now. But that's going to take your advocacy, your voices that have already been working throughout this, staying in touch, continuing to help try to bring everyone together and to bring one voice, one strong voice to this concern. The time is short. We've never been in a time such as this where the budget is going to be created this quickly or signed this fast. So what happens is going to happen very, very fast. Recovery is real. We all know it. We all know that if we don't do this, we don't go back and try to find some ways to make this better. It's just unimaginable what could happen for many people. Not only is it affecting those who need help, it's affecting those who give help. Most of the employees I know are recovering and staying in that life all of their life. The dollars that we see right there, but the dollar savings for every life we reach out and touch multiply in ways that are just, they're even hard to measure and track. So I'm on your team. I always have been. I will be. I join with those that you've heard from today, and we'll certainly be working to help Representative Allen keep this very alive among our members. But I just want to encourage you to continue, and thank you. Thank you so much, Jeff and Neil, for the work you do every day. You're saving lives, even in a time when we can't touch one another.
Thank you, Representative Dempsey. Now, I hadn't cried on any one of these, but this is the first. So thank you so much. I'm overwhelmed. Take it away, Jeff.
Mr. Chairman, it's about 12:51. With your direction, we could see if there's a couple of questions from some of the participants. If there's no other member that has already indicated that they would like to ask a question or make a comment.
I have not heard from anyone else that wanted to speak, so go ahead if you had a couple of questions for the next 10 minutes.
Sure. I do think we've had a lot of comments, and of course the comments are appreciated, but there's been at least one specific question. And I'm gonna just be human and say I got to scroll up to find it, everybody. So, but it was a legitimate question. Here it is. What, and I guess, sir, I'll direct these at you, and you can lead the members in any way you see fit. What can we do today to help make very clear the consequences at the state level for demolishing our peer workforce, lives, families, and communities we serve? So I think I will add a friendly amendment to that question. These folks have heard from Neil and myself. From the perspective of the leader of the working group, how can the peer recovery community and their families, friends, and allies, how can we best help and be of service to the working group on addiction and recovery?
Yeah, I'll answer my answer, and then if any other member wants to jump in and kind of amend it or add to it. I think it's very important. I mean, the RCOs, like Senator Utterman talked about, they stretch all over the state. And it's very important that we bring as many of the members of the General Assembly into this conversation. So if you have that intimate relationship, that relationship with your local elected official, your local senator, your state representative, I would encourage you to reach out to them. One second, my 4-year-old. I would encourage you all to reach out to them to make sure that they understand your concerns as well. And advocacy is going to have to be done a lot different than it normally is because of the social distancing and the rules that we're going to have around the General Assembly to have everybody come down and advocate the way we've normally done is probably not going to be as realistic. But I would encourage you to now start reaching out to your members and making sure they understand your individual positions, that your peers are calling them and emailing them as well to let them know their positions so you can advocate in a different way.
That makes a lot of sense, sir. And I guess if another member wants to comment, Brian Kite and William are on the board. And Brian, if you and William see a member, quote unquote, raise their hand, speak up. But Representative Allen, I think, it would be good to share with folks. We saw a document that was made public, which is the only reason why I saw it, about some of the protocols the Georgia Building Authority is proposing for the session. And of course, a lot of them are medically and scientifically driven. It makes sense for the protection of everybody. But your point is so well taken that, entities, groups may have to find different ways to get their message across. And maybe that's a good segue until we see another question pop back up. And if you've sent a question a long time ago, there's so many in the chat, resend it to Brian now so he can re-see it. But Neil's got a slide, Neil, about, there it is. We are having what we hope is an effective yet safe with social distancing car rally for recovery. And it's not just cars, it can be your favorite Harley or your whatever you ride and drive. Sorry, I think that was my 20-year-old. We're having a, can somebody get the schools back open? Just kidding. We're having on Tuesday, June the 9th at 12 noon, around 11 or so, we're going to meet over there at the Olympic Torch. Everybody knows what that is, right there by the old Turner Field, by the new Georgia State football stadium, right there at I-20 and the connector. We're going to meet and we're going to put some positive signs that people make at home on the car. And we're going to drive around the Capitol a little bit to get a little bit of attention. We've seen this in several cities. We don't believe that we need to be gathering and standing all next to each other. That's not scientifically safe, but this is one of those creative efforts we're trying. It's just to give the working group support, let them know that they can demonstrate, hey, look what they did. And we want all of you that are able to get up to Atlanta, get by that torch about 11 o'clock and be a part of this about 12 o'clock. And it won't last long. And we're going to have a good day there. We will be reaching out to the RCOs, and we will be working with our statewide peer leadership. We'll be doing things in districts that are practicing safe social distancing. We'll be getting on the emails. We'll be getting on the phones. We'll be getting on the social media. And we'll be doing all those things that are creative. And you'll hear from Neil and Jeff more than you want to hear from us. But we'll do the very best we can to make sure we're being as creative as we need to be to give these members who have taken time out of their very busy schedules to be with us today. And I would like to turn it back over to Neil and Chairman Allen by simply adding my personal thanks to every person on this call and to all the people and
Jeff, you there?
Oh, looks like his,
Yep.
it looks like we may have lost Jeff.
Yeah, Eric.
While he's reconnecting, Neil, I just want to make the offer. I mean, you and I have worked together for years, even when I was at the department, and you know how creative I got with some of the funding and budgeting when I was there and you know, kind of doing that. So one of the things we may want to do is reach out to Commissioner Fitzgerald and just have the conversation, because I'm pretty sure some of the disproportionate cuts in these programs are somewhat related to the settlement. And what can, I mean, there's a lot we can do in that. So I think one of the things we should also do is reach out to Commissioner Fitzgerald and maybe have a conversation as well about some of the rationale behind that and looking at some alternatives that we can help her with.
Certainly. Yeah, well, I'm happy to do that. I think that's a great idea, Eric. And then, you know, we will get loud. And I see it on some of in the chat box that some of the folks from the rural communities are saying they can't get up to Atlanta. We'll help you organize on your level as well, because the rural communities are hurting, and we'll help you with that. But yeah, I think talking to the department is a good idea. We were just waiting for it to get released because they weren't answering questions before. So I think it's a good time to do that. This, you know, we're in it for the long haul. We will advocate. We are the evidence. If you want some evidence-based practice, I'm the evidence that this works. I'm the evidence for 30 years. I've stayed out of jail, stayed out of trouble, don't speed. I don't break traffic laws like I used to. So, and we have thousands and thousands of people like me around the state that are willing to speak out and say, we are the evidence, we are here, and we're part of the solution. So we plan to do that, absolutely. So,
all right, well, I think we lost Jeff. So if you want to wrap us up, Neil, it's right at the top of the hour.
Let me do a couple of reminders that we have. So we have started a Spanish speaking all recovery meeting twice every Tuesday at noon, and then let's see, I think we started one in the evening too, but it's not on this one, but it's on our website. So we have 2 per week. I believe it's Tuesday at 7 as well. So if you know of anyone, please spread the word. We have a Spanish speaking all recovery meeting. That community is hurting as well. And then, of course, every day we have virtual all recovery meetings at 10 a.m. 10 a.m. and 7 p.m. We have 2 of our recovery coaches at least that are on these calls that are facilitating. I did one on Memorial Day, and we had close to 30 people on a holiday. Everybody on holiday. It was amazing. And they're just really great meetings for anybody. You don't have to be in recovery to join these meetings. You can be someone who is supporting someone in recovery, someone who is seeking recovery, or just someone who wants to know more about what we talk about in meetings like this. You're welcome to come and be part of the solution. And you know, I've got some numbers that we're going to be sending downtown about how many folks are signing on to these in the COVID epidemic. And then we're starting in June appropriately. It's LGBTQ month, and we're starting a Pride in Recovery month. Larissa, Jody, myself, and William will be starting these up and facilitating them starting June 4th at noon. And we've actually put this out to around the country, and we're getting so much attention. So a week from tomorrow, I believe it's the first one. I have no idea what day it is with the holiday. And then just to say a last thank you to everyone. We are Georgia Strong. We're Georgia Recovery Community. We're not going to go away. We're here for each other. We show up for each other. We are the solution. We're part of the solution, and we are the solution. So we'll be here June 3rd next week at noon.
I'm back.
And Jeff is back. Jeff, anything you want to say as we say goodbye?
Yeah, I'm going to need to talk to Zuckerberg about what just happened there. But so on that meeting that Neil's talking about on June 3rd, that's also going to be a very cool meeting. We're going to have a special presentation related to the budget also from some great allies at Neil, what's the right name of it? Health?
Georgians for a Healthy Future.
Georgians for a Healthy Future, we're going to talk about parity. We're going to talk about ways to expand the state budget that increase revenue that don't necessarily mean cutting programs. So it will be related to recovery, and it will be offering some options to support the budget in general. And I encourage every one of you to get on June 3rd, because there's going to be a lot of positivity going on that meeting that's related to what we're talking about today.
Beautiful. And thank you all. Jeff, anything else? You'll be hearing from us, folks. Check our social media. There is so much we could do on social media. Remember what we said last week at our rally. This is a very compressed time frame, so we are going to be hitting it every day, hitting it a lot, because folks need to hear from us. So thank you. We're not going anywhere.
And I do just want to say that I think I got cut off before I got to say thank you to the members. And I want the members to understand how thankful that I am on a personal level that they were on this call today.
Thank you.
Thank you, Neil, for your time. William, Brian, for running the board. And we'll be back Thursday at 3 o'clock with the Neil Campbell report, and back next Wednesday with this meeting.
All right. Thank you, guys.
Thank you.
Thank you, sir.
Bye-bye.